Okay guys, I'm going to show you how to use your sleep aids. There's a larger one and a smaller one. The larger one is for the neck, smaller one for the low back. These are quite easy. All you have to do is lay on them. So Michelle's going to go ahead and lay on your back. We're going to put the larger one right underneath the middle of the neck. Perfect. And the smaller one underneath the low back. Now, as far as placement of these goes, notice that Michelle, she's relaxed. She does not have a pillow or anything, so she's flat on her back. She's using these rolls to support the spine rather than like a pillow will contort the spine usually. And notice here that her head is not leaning up towards up above her, or it's not scrunched down. It's a pretty neutral position, so she's just looking pretty much straight up at the ceiling. If for some reason you're laying on that roll and you do end up with your chin up or down one direction, that would be a time when you might use a small pillow or something or towel to help neutralize the neck until your spine is a bit healthier and can just relax back over this. The roll in the low back is going to be just above the hips and below the ribs. So you're going to find a spot kind of right in the middle that's soft. So again, above the hips, below the ribs. That spot where there's kind of some soft area, that's usually pretty much right where we want to have the sleep aid. And sometimes you are, just depending on what's been prescribed, you may use one or the other or both. Most people end up using both. Ideally, you want to try and start laying on these for 10, 15, 20 minutes at a time. Ultimately, you want to sleep on them. So if you can get to a point where you can at least fall asleep on them, then if you wake up and you're uncomfortable, you can just go ahead and take them out, grab your regular pillow or whatever else and sleep however you'd like the rest of the night. But definitely try and start on these. Work your way up to about 20 minutes or so. See if you can fall asleep on them. And then if you're consistent with it, pretty soon you'll be sleeping through the night, super comfortable and loving these things. But those are the sleep aids and placement. Again, larger one goes for the neck, smaller one for the low back.